The gentleman from Suffolk, Mr. Jones.
Mr. Speaker, I rise for a point of personal privilege.
Gentleman, may proceed.
Speaker, ladies and gentlemen of the House, I'd like to speak a little bit today about the budget, continuing with the theme that was begun yesterday by our chairman and Delegate Cox on a number of steps that the Appropriations Committee is taking to address specific concerns that have been raised by members of this body over the past 5 weeks relating to providing relief to local governments, increased funding for public education, shoring up the health care safety net, and addressing the long-term structural balance of Virginia's finances. Today, I would like to elaborate on some of the actions that are related to health and human services that the committee will be addressing in its recommendations on Sunday. First and foremost, I want to state to this body that we have listened to the concerns of the members of this body and the public relating to funding the health care safety net. Safety net organizations provide some of the most cost-effective health care to thousands of sick and uninsured Virginians who rely on them for life-saving treatment and medications. Last year alone, these organizations provided care to more than 198,000 uninsured Virginians. Consequently, we will put forward recommendations to restore, I would like to say, to restore funding to the free clinics, community health centers, dental services provided through our local health departments. We will also propose additional support for mobile crisis services for children with serious mental health disorders. We also heard your concerns regarding Medicaid funding, our hospitals and nursing homes, who are not only important partners in providing and caring for the sick, aged, and disabled, but also major employers in many parts of our local economy. It is only fair to expect that payment to these providers are adequate to ensure access to these services and the delivery of quality care for low-income, vulnerable Virginians. While we applaud Governor McDonald for restoring funding for nursing home capital improvements, we believe it is imperative to fund the reasonable cost of providing direct care to the elderly and disabled in these facilities, as well as our hospitals who receive on average of 64 cents on the dollar for care provided. The amendments we propose will provide physical relief to these providers. Finally, let me address something that has been on the minds of many since last year. The concerns that many of you have shared with us related to the services to individuals with intellectual and developmental disabilities. As many of you know, expanding the availability of home and community-based waivers through Medicaid waiver program has been a high priority for this committee and this body over the last decade. Even in the toughest economic times, we have led the charge to increase these services and have had your full support along the way. Since 2002, we have provided the following, and we all should be proud of this endeavor: 3,081 community intellectual disability or ID waiver slots, 300 ID day support slots, and 450 developmental disability or DD waiver slots. And we have had tough economic times in the last 10 years. I think it speaks to the bipartisan support and the cooperation that we have in this chamber looking out for Virginians. Last year alone, we provided 275 additional community ID waiver slots and 150 additional DD waiver slots for individuals who are on the waiting list. In the wake of the U.S. Department of Justice findings that Virginia was not providing services in the most integrated and appropriate setting and that our discharge process at the state training centers was flawed, we judiciously set aside last year, Delegate Cox's bill, $30 million into a trust fund to be used to transition these individuals from our state training centers to the community. That funding provided a critical down payment for the services needed to move Virginia forward in a more comprehensive system of community-based care for disabled individuals and their families. I want to applaud Governor McDonald for adding an additional $30 million this year to that trust fund to address the DOJ settlement. This, along with the $30 million from last year, will do the following: 160 new ID waivers per year of the biennium to transition individuals from state training centers to the community, 225 new ID waivers to address a community urgent care waiting list, that's per year, 25 DD waiver slots for each year, and we will serve 1,000 individuals through a new individual and family support program designed to keep them at home and avert the need for institutional care. Nevertheless, many of you have come and asked Steve and myself and members of the Appropriation HHR Subcommittee, what can we do to alleviate the waiting list that is growing by about 2 individuals per day? Many of these individuals are in desperate need of services as their parents and caregivers become elderly and are frail, and their needs become too great to be sustained by the family alone. At this rate of growth, we will fail to achieve our objective, which we set out in this chamber years ago, to eliminate the community waiting list by the 2020-2022 biennium. And I know you should never do this, but I really want to highlight several members of the Appropriations Committee, especially the chairman. Chairman Putney deserves a tremendous amount of credit because we always go begging in the HHR Subcommittee. It is the toughest subcommittee to serve on, not because I serve on it, but because of the issues that we have to deal with. And the chairman has been very gracious, and he's worked with Delegate Cox and Landis, who have been leaders for the last 10 years on trying to find additional slots. And I'm pleased to announce that we're going to, on Sunday, to add additional slots for the DD and ID waiver slots for the community that you will see on Sunday. Mr. Speaker, the budget is about tough choices. And I think that we have demonstrated with our inclusion of all 100 members from the very beginning at the leadership of Delegate Putney, the chairman, our esteemed chairman from Bedford, that we listen to what Virginia has to say and that we take to heart our responsibilities as appropriators and as a member of this body. And I want to associate myself with the chairman's remarks from yesterday and Delegate Cox's as well, and those Delegate Landis a few minutes ago, that this budget that you will see on Sunday will reflect a bipartisan approach reflective of the comments and the concerns that we have received from each and every member in this body. Mr. Speaker, I thank you for the time of the body.